Well, President Obama focusing on health care reform today. He met with a bipartisan group of governors on the issue, and later tonight he'll hold a town hall meeting. The president is looking to overhaul our nation's health care system, and Congress is currently looking over the $1 trillion proposal. The president is vowing he won't sign a reform bill that raises our nation's deficit, but the $1 trillion price tag is just one of the causes for concern on health care overhaul. Oklahoma Congressman Frank Lucas joins us now from Washington, D.C. with his thoughts on health care reform. Congressman, appreciate you being with us. First off, tell me, how many health care reform plans are there currently in Congress? There are a number of them.
Oh, yes, Kelly. There's clearly a half a dozen in the works. There will be more as this process goes along. And remember, if this has worked as it should be through the proper legislative order, there'll be amendments at the committee level, at floor level, amendments in the committee of the other chamber or at the floor level. Once again, there'll be a lot of twists and turns on this process.
Do you like any of the plans you've seen so far?
Well, I find Senator Coburn's plan to be very interesting because Tom has a lot of expertise in the healthcare industry and I think wants to move forward. But the base bill, what appears to me to be the base bill, clearly is Senator Kennedy's efforts over on the Senate side, and we'll see how that comes together. Admittedly, this process has started in the United States Senate, but most of the numbers you see crunched, if it follows the parameters of what President Obama wants, you're talking somewhere between $1 trillion and $1.5 trillion price tag. And right now, when we're running what may already be a $2 trillion deficit this year, that's one of the biggest challenges, is coming up with enough money to pay for whatever kind of changes they advocate.
Have there been any ideas offered yet on how to offset that $1 trillion plus price tag?
Well, Kelly, I would tell you, I suspect that's a little bit of another bill that we're about to vote on this week in the United States House, referred to by some as cap and trade. I think it's better actually called cap and tax and national energy tax. That may generate $700 to $1 trillion itself. And where that money goes, Speaker Pelosi won't say, but that could wind up in health care. Now, I do 50 town meetings a year, Kelly, across my 32-county district, and there's a lot of concern about cost and accessibility. Most of my constituents like their doctors, they like their hospitals, they like the health care we have, but they want to do something about the cost and the accessibility, and that's where we go. Do we wind up with a Canadian, European-style system? Will the administration let us talk about a German type of insurance-based system? Whatever the case may be, let's don't mess up the good things we already have in health care in an effort to create something basically that'll be a government-run system that would be detrimental.
Now, Congressman, the key component to all of this health care overhaul talk is a government health insurance plan to help cover some of the 46 million uninsured Americans. The last numbers I saw, the $1 trillion initially being talked about would only cover about 16 million of those.
You're exactly right, Kelly, and where they come up with enough money to do the rest. And how do you make sure that when you provide a government-run option, that doesn't drive private health care out? Because right now, if you're over 65, you've got Medicare. If you're under the poverty level, a certain number, you've got Medicaid. If you work for government, state or federal, you're covered in a lot of municipalities. Or if you work for a company that's big enough to deduct the cost, you have private health insurance. Or if you're prosperous enough yourself, you have your own insurance. It's the people who are caught in the middle that we're talking about. They're the ones who show up at the emergency room, who don't have a way to pay their bills. They're the ones who are provided health care by the doctors who can't pay their way. Those costs then get spread out over the rest of us. I personally think that's the focus. How do we address the indigent health care, I guess is the polite way to put it? How do we make sure those folks are covered? Because right now that's driving up the cost of health care for everyone else. We'll see what the President and the United States Senate come up with, Kelly, but let's not botch up the best health care provider system in the world, and let's do whatever is done if we do something in a way we could pay for, and that's a challenge.
Oklahoma Congressman Frank Lucas from Washington, we appreciate your thoughts. We'll continue to follow this. Obviously, medical health care reform is a big issue, one that needs to be addressed, but how do you fix it?